Can you guys introduce mommy?
Spill the beans with Dr. Jail.
Hi, everyone. Thank you so much for joining on today's episode of Spill the Beans. As always, I'm going to ask my guests to introduce themselves to you.
Hello, my name is Goetti Francois. I am a psychiatric advanced practice registered nurse. I work currently at a private practice in New Haven, seeing clients outpatient. I also work some per diem roles where I work in community mental health outpatient as well. Some of my background includes some time teaching as well. I love education and helping kind of shape the next generation of our helpers in the nursing field. So I have some background in working as a faculty member at previous institutions, as well as clinical coordinating and instructing on ground with nursing students as well.
It's so exciting for you to be here. There's so many points of vicarious trauma that I want to ask you about. But I guess my first question is because you have so many letters after your name, right?
Yeah.
Can you tell us what all of your licenses are?
Yeah, so I have my master's in nursing, the MSN. APRN is Advanced Practice Registered Nurse. So I went back to school after getting my registered nurse to become an advanced practice provider, where now I'm able to assess, diagnose, and treat mental health conditions alongside other colleagues. Let's see, I'm board certified, so it's PMHNP-BC, and then I think I think that's all I have in there. Yeah. So
Yeah,
those
it's a lot.
that's the alphabet soup.
But tell us how many years, if you can even remember, have you been in school for these credentials?
That's a good question, Jill. I saw a previous episode of yours where someone was joking about the long journey that wasn't linear with her
Yeah.
nursing career, and I think similarly, I went to UConn for my undergrad. I was unsure what I wanted to do before I went to school, but in my high school time, I did everything. I was in EMT. I did every extracurricular possible, volunteering. So I knew I wanted to help, and I knew I was very indecisive. Both my parents are in the healthcare field, and they were like, just do nursing. You could figure it out as you go. Just do it. So I did it. During my time, it took me some time to finish up my degree, and I was able to also get a degree in sociology. So I came in with a lot of credits in college because I was doing too much in high school, and gave me a little buffer. So I was able to essentially finish a sociology degree in like a semester and a half. And then altogether, that was 6 years to get both of those degrees. And then I worked for about 5 years and decided that I wanted to do more. I saw clients of mine in the hospital that I was really engaged in their care. I wanted to understand how to be a bigger player in the decision making of their treatment. So through kind of talking with others, exploring my options, I decided to go back for my APRN, and that took 2 years. And during that time, just understanding that next level of care and being part of the clinician world and helping clients at a different level. So that was 2 years. So altogether, I'd say 8 years.
Wow.
Yeah.
Super dedicated to the helping profession and learning your craft. When you went through all these classes, was there ever a vicarious trauma class?
So something else I forgot. I am a Teach for America alum, and so I did a year of education work as well. And the reason why I just thought about it is the only time I could really think of it being in a focal point of me in school was around the education piece. So I
Mm.
was in Rhode Island teaching third graders, and I think in that master's program that we was like kind of part of the program that we had to be in, the trauma and like understanding our students' stories that came up during that. But when I think of my undergraduate time and also my graduate. In my graduate program, I did a concentration in gender, sexual health justice. And in those classes, I think that professor who ran it was very intentional about going into trauma, understanding how to be a trauma-informed provider.
Sure.
And that was just a unique opportunity that I was able to participate in. But outside of that, in my traditional classes that everyone else took, no, it wasn't really something that we focused on.
It's interesting because this whole season I've been working with other medical professionals like yourself,
Mhm.
and they're all saying the same thing of, I know trauma-informed care and I
Yeah,
know how to help the person when they're in trauma, but no, my trauma from doing this job, that's not been a thing.
yeah, yeah,
With having, because you opened Pandora's box by sharing with me that both your parents are in the medical profession,
yeah.
did they ever talk to you about how you're going to manage the cases or what they do for longevity?
No, I mean both of them were are nurses, and I just remember they go to work, they come home, and we're together. They never really, my mom would vent and talk about work, but it was never like these are the things I'm gonna do for self-care or this is how you should manage. I think I would say sometimes would frequently say like, make sure you take care of yourself and
Mhm.
work is work and kind of like she's very good about like compartmentalizing. I'm at work and then I'm home. So that piece I think I got from her in terms of like being honoring what you need and even if it's hard, saying no if you need to say no, not pushing beyond what you need to do in the work field and being strategic about that. But explicitly talking about trauma or the impact of what's happened while they were working, no.
Wow, that's fascinating. What keeps you in the field? What is working for you with your self-care?
I love being social. I am really active in my community. I have a lot of connections both here in my hometown of Stratford and all over Connecticut. And I think those connections are a really big piece of it. I saw you're a Waterbury native,
Yeah.
and my sorority is Zeta Phi Beta Sorority Incorporated. We actually just chartered a chapter in Waterbury this past earlier this year, and that being able to like give back in Connecticut, being able to be part of just getting out there, getting involved where we're needed, that helps. And now I'm saying that like that's also helping, so it's not really feeding fully me, but
Yeah.
it's rejuvenating and it's
Yeah.
nice to like, do that in my free time. I think treating self-care as medicine, right? So for
Mm.
me, it's like I know I feel better when I'm going to my Zumba classes or going to my workout course classes. I know I feel better when I'm sleeping and cooking food and eating well. So just really trying my best to prioritize those things, spending time with family,
Mhm.
and just really making sure that when it's getting too much, I'm able to identify that, take a step back, and kind of figure out the next steps.
I would want to dive a little bit more with you because my assumption is that you've had some pretty intense situations with the mental health and, whether it was, post COVID or what, there's a lot going on, right? But let's say that you had a client that was really in distress and you have to hit a reset. Is there anything in the moment that you can do that you have found to be helpful for other practitioners?
I think a few things. Therapeutic silence, sometimes when we're kind of, especially like that initial getting to know each other, I find that the client's really like revved up or anxious or it's a lot, right? You're sharing your life story with someone that you met 5 minutes ago. So sometimes I try to give them a moment and I also take a moment and just allow things to settle and give them a pause. Also, the more elevated my client gets, my automatic response is to get calmer. So
Mm.
kind of mirroring the behavior that I want them to have, or being that calm, consistent when
Mhm.
they may feel dysregulated in some capacity. So I think just practicing that and always remembering it's not about me, right? Like this is a learned trauma response potentially. This is something that it's indicative of maybe psychologically feeling unsafe in some capacity. And all those things are separate of something that I essentially, I have the power to help and be mindful of how I could contribute or make it worse. But ultimately, it's not personal, right? And I have to frequently separate myself to make sure I'm aware of, I have power in the sense of how I react and being therapeutic, but their reaction or potential frustrations is beyond just our interaction right here.
How do you give, you said honoring what you need. And I love that. I almost think that that's going to be the name of the title of this session right now. But how would you recommend that younger professionals coming into the field lean into that more? Any
Um,
recommendation that you have? Because I'm assuming that there's people watching this who are going to say, well, it's easier said than done. You
yeah,
can't
yeah.
always do that. Any
Um,
tips on that?
Definitely having a sounding board or multiple sounding boards. I have clusters of friends and family that I go to and talk to about things. Some from my previous jobs, people that I've stayed close to, colleagues in the field, mentors, my siblings, like just having people that you could trust and talk to about what's going on.
Mhm.
Also having your own help. I love my therapist. I always joke with her. I'm like, I don't know what you're trying to do, but retired or not, you're stuck. We're right here. She's
Right.
also a coach, and I think that really helps to kind of have that solutions focused person who is also in the helping field to then sometimes our appointments turn into a supervision where I'm just like, talking through cases or telling her how I felt. And I think having these consistent people in my life that I could also go to is really crucial. Also, sometimes honoring what you need is hard. Like
Mhm.
I recently had a career shift, ending a role that was really hard to end. And because I made a lot of great connections with my faculty colleagues, I made good connections with my students. And I had to take a step back and realize there were things that I was not able to do for my health. There were things that with my little one, I couldn't honor what I want to do in terms of how I want to parent and be present. And I had to ask myself, how am I going to pivot to make things to honor the fact that I want to be this type of mom and do these certain things. I want to be here. And we only have 24 hours a day. I keep trying to find that eighth day of the week, but still not happening, right? So just taking a inventory of like what is happening, what do I need, and making a path forward, even in a moment of uncertainty of what that may look like, but still making the decision that I know is honoring and not really and making sure I'm not in self-betrayal, where I'm doing something even though I know I'm betraying the needs that I need for myself.
I love that. I'm writing those notes down to be able to reflect later. You mentioned two things. I want to make sure the audience realizes the transfer into vicarious trauma world. When
Mhm.
you're talking about your sounding board, those
Mhm.
are protective factors. And that
Yep.
is like the first way that we can nurture our vicarious trauma. And the second thing that you said, which was like money, was you said the self inventory. And I cannot tell you how many times I had practitioners say, I think I'm going to quit. I'm burnt out. And I'm like, well, when was the last time you did your self inventory? And they're very befuddled. And I'm like, oh, well, that's what this looks like, right?
Yeah.
Um, I love that you're echoing some really great behaviors that you're doing that you tell others to do in a way that's nurturing their vicarious trauma, not even knowing that, right? And I end every session asking the audience to open up some wisdom from you of if you had to spill the beans on this idea of vicarious trauma and things that you've learned, what would be the one quote, the one mantra, the one thing that you would want us to hear from you today?
I think that's a tough one, but
I
I think
know.
um
And the other thing that I would say is that this is coming from someone that not only is the medical profession, you've shared your identity as being a mother and you're an educator. So feel free to go any tangent that you want us to hear from you today.
okay. Um Everyone has a story that's beyond the time that you're spending with them, and you also have a story that comes out in different ways. So, while honoring and giving grace to others during those interactions of helping, but also the flip side of that, honoring and giving grace to yourself in those moments that you feel maybe you feel a bit more elevated or you need that help. And I think, as someone who's helping in these different capacities, we are the toughest patients, right? We are the toughest to be like, hey, I need to talk to someone too, or hey, I need a day off. And I think realizing that it's not a sign of weakness, it's actually a sign of really great insight and judgment to be able to identify that and then act on it. It's one thing to say it. Like I have a lot of times my colleagues are like, I can't believe you're able to do that. It's like, you can do it too, right? So it's
Mhm.
okay. Not, it's one thing to like acknowledge the problem, but it's another to be brave to then combat it and make a step forward to change it. So it's a sign of bravery and not a sign of weakness to honor that and to take care of yourself.
Magical soundbite for me. Thank you so much. With that, I'm going to leave and say thank you so much for watching today's episode of Spill the Beans. Thank you, everyone. Hi, everyone. Well, that was an amazing conversation with APRN Goetti, Francois. There are so many things that I was taking notes as they were talking with us. One of the gems that I referenced was this idea of taking care of yourself is medicine. No one has talked to me about it like that. Like, yes, we all know that self-care is really important, but no one has actually said it is medicine, just like you taking your vitamins or you going to the doctors and getting medication. Self-care is as important of a medicine. And so that really was game changer for me. Sometimes I have new colleagues or new professionals who talk to me about their self-care plan and how they want to take mental health days. And sometimes I might come off a little judgmental about that because that's not the generation I grew up in. My generation was very much of if you have a problem, work around it, acknowledge it, but figure it out. This generation coming up is very vocal about what they need in the workplace, and my hat goes off to them. I am very much in admiration that they can communicate so effortlessly about what they need. And I do think that that is something that I am learning from them. And the therapeutic silence is something that I also have used with some of my more difficult cases. And I would take it one step further. This particular professional was saying in the client to client place, you want to take that therapeutic silence to not exacerbate the conversation and to bring levity and calmness. I would also say that that's what we should be doing with our mind and our bodies after we hear those intakes, right? So you deal with the patient, you deal with the client, you deal with the student, and now it's just you. Give yourself that same silence. One of the things I had recently heard was whether you say you can do something or you say you can't do something, you're 100% right 100% of the time. And that's because the power of what we say to ourselves is so much more impactful than our abilities. That negative self-talk is really what I'm asking for you to silence. Whether you're criticizing yourself of how you could have done that appointment differently or how you could have treated it differently, that time, that decompression after you've done the intake or you've done your meeting should really be about nurturing yourself for your own medicine. So I hope that that conversation became full circle for you. I know that I had a great time and learned so much. So take care of yourself, and we'll see you next time. Bye-bye.